I would put at the top of the list investment or reinvestment in what it takes to sustain the water supply that we have today. You know, the water systems that we come to expect water coming from each and every day were built decades ago, and in many places there hasn't been enough investment to maintain it, to keep that going, and so we're at greater risk today of those systems failing than we have ever been before. So that's the most important, because if you want to have water, you need to have a water system. But if you have a water system and it is supplying water, there are some actual risks in drinking water that are important for public health protection. I put Legionella and Legionnaire's disease at the top of that. Unfortunately, it is on the rise. We know the people who are dying from Legionnaire's disease, and we can and should be able to do a better job to avoid those deaths and those illnesses. And then the last is better just balancing all of the other contaminant concerns that we have. And there are a variety, and this isn't meant to scare the public to know that there are risks in drinking water. It's just that there's an entire community of water professionals working each and every day to address and minimize those, whether it's naturally occurring things like arsenic or the use of chemical disinfectants like chlorine that can cause disinfection byproducts. All those things have to be balanced. And I think the key thing in prioritizing those risks is have communities put their efforts towards addressing what's most important for them. Because in one community it might be one thing and in others it might be another. And right now there isn't much flexibility around that, and there's a problem with how communities don't get to prioritize what matters most for them.